I hope you're having a great day. I quickly wanted to talk about some of the complications that can occur if an individual with HIV does not get treated. So the most obvious complication is progression to full-blown AIDS. I talk about the difference between HIV and AIDS in one of my earlier videos. You can refer to that video to understand what I'm talking about. So some of the complications we see if individuals are not treated for HIV is that they can have AIDS-defining infections. Some of these infections can affect the brain, they can affect the lungs, and they can affect the intestines. And these organisms are organisms that usually do not cause problems. They're always present, but if your immune system is intact, it can fight these infections. There are a whole whackload of infections. It's going to take a long time to talk all about them. I'm going to list them in the description below, but some of these infections include things like cytomegalovirus. They include things such as TB, not always, but they include things such as pneumocystis jirovecii and other infections of the intestines such as Isosporidium. Other things that can happen if individuals are not treated for their HIV and progress to having AIDS is that they can have malignancies such as PML and another malignancy such as Kaposi sarcoma. Again, I'm going to list all the malignancies in the description box below. Other challenges is that individuals can end up with what we call HIV or AIDS-related dementia, meaning that their brain does not function the way that it should and they might have memory loss. And there's a wide spectrum of how this HIV-related dementia or cognitive impairment presents. On top of that, individuals can end up with HIV wasting syndrome where they lose a lot of weight unintentionally, they're unable to keep on weight, or even their appetite is very suppressed. I hope you found this series on HIV and AIDS useful and informative. Bye-bye for now.